Welcome to the deep dive. Today, we're going to try and get to the bottom of something that can be, well, a real pain, right? Visceral pain. It can be so hard to figure out what's going on, that deep, achy feeling. Anyway, we're going to be diving into some research from Dr. Erik Gandino.
Oh, yeah, he's great.
He's an osteopathic doctor, been in the field for over 20 years.
Wow.
And get this, he specializes in this thing called the counter-strain method. Super interesting stuff.
I've heard of that.
He's actually the head honcho over at the Jones Institute Europe, too. So he really knows his stuff. And his insights into visceral pain are, well, fascinating. It's like solving a mystery,
Yeah, like where's the pain really coming from? It's not always obvious, is it?
Exactly. You think, my stomach hurts, must be something I ate. But visceral pain, it's sneaky.
It can be all over the place.
And it can come with all these other symptoms that just make you feel awful. Nausea, sweating, you name it.
The worst.
One thing that really surprised me, reading through Dr. Gandino's work, was that our organs, they actually have fewer pain receptors than our skin.
Really?
You'd think it'd be the opposite, right?
Yeah, you'd think they'd be super sensitive.
I know. But Dr. Gandino, he explains that it's actually a good thing. Imagine feeling every little gurgle and movement in your gut all the time.
Oh, I don't even want to think about it.
Apparently, organs, they don't have the same kind of receptors as our skin for touch and pressure. Makes sense when you think about it.
Right, like you don't want to feel every bite of food as it goes down.
Instead, they mostly rely on these things called C fibers and A delta fibers. Sounds a bit technical, I know.
It kind of does.
Maybe you can break it down for us a little.
Yeah, so think of those fibers as like messengers.
Okay.
They carry the pain signals, right, from your organs to your brain.
Ooh, like tiny little telegraph lines.
Exactly. And, well, we do have some of those fibers in our skin too, but way fewer in our organs.
Huh. So that's why.
That's why when we do feel pain in our organs,
It's so intense.
right, and it can feel like it's coming from a much bigger area than it actually is.
So these pain signals, they're coming from the organs, traveling along those little messenger fibers. Where do they go from there?
Well, they take a trip through our nervous system. It's quite a journey.
I bet.
Dr. Gandino lays out three main pathways. There's the vagus nerve, the splanchnic nerves, and the pelvic plexus.
Whoa, the pelvic what?
Pelvic plexus. It's like a bundle of nerves. Anyway, these pathways, they're like the highways for those pain signals.
Okay, so they're zipping along these highways to
the spinal cord,
Yeah.
and then from there, it's up to the brain.
But wait a minute, it's not always a straight shot to the brain, is it?
No, not always.
It can get kind of messy, right?
It can. It's like the signals. They can take a detour or get mixed up along the way. Like your brain might think a pain signal from your stomach is actually coming from your shoulder.
What? No way.
Yeah. That's what we call referred pain.
So that's why sometimes it's so hard to pinpoint exactly where the pain is coming from. You think it's one thing, but
it's actually something else entirely.
And to make matters worse, Dr. Gandino says the vagus nerve, remember that one?
Mm-hmm.
It can actually make the pain signals even stronger, like turning up the volume.
Yikes.
And it also contributes to that, yucky feeling you get when you have visceral pain, all sweaty and nauseous.
Ugh, I know exactly what you mean.
Makes you just want to crawl into bed and hide.
Yeah.
But hold on a sec. Let's back up again. What actually triggers this visceral pain in the first place?
Okay, so Dr. Gandino, he says there are three main things. Distension,
Distension.
like stretching.
Got it.
Then there's contraction and chemical inflammation.
Okay. So explain this to me. He says solid organs, like your liver, they're most sensitive to distension of their capsule. Capsule. What's that?
So every organ, it's got this tough outer layer, like a protective shell, and that's the capsule.
Uh-huh.
When that capsule gets stretched or distended, that's when the pain signals start firing.
So like if you get punched in the liver,
Exactly.
oof, makes sense. But what about hollow organs, like the stomach and intestines? They're a bit different, right?
Yeah, they're a bit more complicated.
So they could experience pain from distension, like if you eat way too much.
Right, exactly. Or if there's a blockage.
But they can also have pain from those strong contractions you get, like when you have bad cramps.
Tell me about it.
And, of course, inflammation in those organs can also cause pain.
Inflammation is never fun.
But here's something you might not expect.
What's that?
Dr. Gandino says one of the most common causes of visceral pain, especially in those hollow organs, is air.
Air. Like just regular air.
Yeah. Isn't that wild?
That's crazy.
But think about it. gas, it's hard to compress.
True.
So when it builds up in your intestines, it puts all this pressure on the walls, stretching them out.
And that's what causes that crampy feeling.
Bingo. And just like with other types of visceral pain, that trapped air can also cause referred pain.
So, wait, you're telling me the stomach ache I get might just be trapped air?
Could be. But it's not always so straightforward. Dr. Gandino also talked about how ligaments and blood vessels can be involved too.
Oh, interesting.
He made a really important point about that, actually.
What was that?
He said that while pain in those structures, the ligaments and blood vessels,
Yeah.
it can feel like it's coming from your organs.
Oh, I see.
It's technically classified as something else entirely. It's called viscerosomatic pain.
Viscerosomatic pain.
Yeah, a bit of a mouthful, I know.
I'll say. But why is that distinction so important?
Because even though the pain might feel similar, the actual cause of the pain
And how you treat it.
could be completely different.
Makes sense.
So pain in the ligaments and blood vessels, it's viscerosomatic pain
Because
because,
they're part of your musculoskeletal system.
right, not your internal organs.
Uh-huh. Okay. Got it. So it can feel like the pain's coming from your organs, but really,
It's those supporting structures causing all the trouble.
yeah,
Tricky, huh?
it really is.
And here's another thing that really blew my mind. Dr. Gandino, he's like, don't assume that organs are just stuck in one place.
Wait, what?
He's like, they move as we breathe, as we digest food.
They're always on the go.
Exactly. So before you go thinking, oh, my organ is stuck.
You got to consider if movement is what's actually causing the pain.
Right. Pay attention to those signals your body's giving you. It's like a detective game.
Totally. Looking for clues.
And here's a big one. Dr. Gandino, he really emphasizes this connection between visceral pain and our spine.
Wait, you mean like back pain could actually be coming from a problem with an organ?
That's exactly what he's saying.
Wow. And vice versa.
You got it. He really drives home this point that our bodies, they're all interconnected, you know?
Like a big, complicated web.
Totally. So back pain might be a symptom of something going on with an organ and a misaligned spine.
Could be affecting how our organs work.
Mind-blowing, isn't it?
It really is.
It's like all these systems are talking to each other constantly. And sometimes pain is just the tip of the iceberg.
There could be a whole lot more going on underneath.
And that's why Dr. Gandino, he's a big advocate for a holistic approach. You can't just look at one part of the body in isolation.
You got to see the whole picture.
Yep. Address both the spine and the visceral system. That's the key to feeling your best.
Makes sense.
Now, remember what we were talking about earlier with the ligaments and blood vessels? Even though the pain can feel like it's coming from your organs,
Right.
it's technically classified as, what was the term again?
Viscerosomatic. Viscerosomatic pain.
That's the one.
It's a mouthful.
It is. But it's important to remember.
Definitely.
Okay, so let's do a quick recap just to make sure we're all on the same page here.
Sounds good.
We talked about how our organs, they don't have as many pain receptors as our skin. Right? And those pain signals, they travel along these pathways, these highways in our nervous system.
The vagus nerve, splanchnic nerves, pelvic plexus.
Yep, all those. And then we talked about the main culprits behind visceral pain. Distension, contraction, inflammation.
And don't forget air.
Oh yeah, the sneaky air. Can't
Right.
forget that one. And then there's that whole thing about referred pain. How the pain can show up in a completely different spot than the actual problem. It's enough to make your head spin.
Definitely not as simple as it seems.
And then, of course, we talked about how our spine and our organs, they're all connected. It's all starting to make sense now, isn't it?
It's all coming together.
But here's the thing that really got me thinking. Dr. Gandino, he talked about how some practitioners use these visceral manipulation techniques, you know. But if our organs have fewer pain receptors and the signals can get all mixed up, how effective can those techniques really be?
That's a good question.
Right. It just makes me wonder.
Me too. There's definitely a lot to unpack there.
I think we need to dig a little deeper into that one.
Yeah, let's dive in.
Okay, let's do it.
It's a bit of a head scratcher, isn't it? Like, if you can't even be sure where the pain is coming from, how are you supposed to treat it?
That's what I keep coming back to. Especially when you consider that Dr. Gandino says organs aren't just sitting still in there.
Oh, yeah. He made that point very clear. They're constantly moving.
So how can an organ be stuck if it's always moving around?
Right. It just doesn't make sense.
And Dr. Gandino, he seems a little skeptical of that whole idea too, from what I gathered.
Yeah, he definitely encourages people to think critically about those visceral manipulation techniques.
I mean, it makes sense when you think about it. The pain might be showing up in one place.
But the problem's actually somewhere else entirely.
Exactly. Remember, referred pain. It's like trying to fix a leaky faucet by patching a hole in the wall.
Huh. Good analogy.
So if someone's considering visceral manipulation, what should they be looking for? How do you know if it's the right approach?
Well, Dr. Gandino, he has a pretty interesting suggestion. He says, pay attention to the patient's breathing.
Breathing? What does that have to do with anything?
So if someone can take a nice deep breath without pain
Okay.
in the area where they're having discomfort,
Yeah.
then it's less likely that an organ is actually restricted.
Huh. So a deep breath can actually be a diagnostic tool.
It can. It's all about those subtle clues the body gives us. Sometimes the simplest things can tell you a lot.
So simple, yet so powerful.
Exactly.
Okay, you know what I keep thinking about? That whole trapped air thing?
Oh, yeah, the invisible troublemaker
It just blows my mind that something so seemingly insignificant.
can cause so much discomfort.
I know, I've definitely had those days where I'm like, ugh, what is going on with my stomach?
Bloating, cramps.
Yeah.
It's no fun.
And it could just be trapped air.
Yeah.
But Dr. Gandino, he actually thinks that even if a practitioner isn't specifically targeting an organ, just the act of moving things around in there
Could help to release that trapped air.
makes sense, right? Kind of like shaking up a snow globe.
Exactly. Sometimes just a little jostling can make things settle into a better position.
So even if they're not unsticking anything, they might be inadvertently helping to move that air around.
That's his thinking, anyway. And it could explain why some people do find relief with visceral manipulation, even if the reasoning behind it isn't totally spot on.
Interesting. So it's not that visceral manipulation is never helpful?
More like it's not a cure-all.
Right. It's not this magical solution for every instance of visceral pain.
Definitely not.
There's still a lot we don't know about how it all works.
Oh, absolutely. It's complex stuff.
We've got to approach it with an open mind, but also...
A healthy dose of skepticism.
Exactly. Speaking of which, remember that story Dr. Gandino told about that patient who always had pain in the same spot?
The one where the ultrasound showed it was trapped air?
Yes. It was like every time they went to the doctor, it was the same thing. Pain in that one specific spot.
And nobody could figure out why.
But then they did an ultrasound.
And boom, there it was.
Trapped air, causing all that trouble.
Who would have thought?
And the crazy part is, Dr. Gandino was able to show, right there during the ultrasound,
Wait, really?
how manipulating the area actually moved the air.
And the pain went away?
Just like that. It was like he was solving a puzzle in real time.
That's incredible.
It really highlights how important it is to consider all the possibilities, you know? Sometimes the answer is simpler than we think.
Don't overcomplicate things.
Exactly. So, okay, let's bring this back to our listeners for a minute.
All right, good idea.
If you're dealing with some kind of mysterious pain, does this mean you should run out and get visceral manipulation?
Not necessarily. Dr. Gandino's big takeaway here is that pain is complex.
There's no one-size-fits-all solution.
Right. Sometimes it might be something straightforward, like trapped air.
But other times, it could be a sign of something more serious.
So the key is, if you're having persistent pain...
Go see a doctor.
Exactly. Get a proper evaluation from a healthcare professional you trust.
Don't just try to self-diagnose.
Or rely on Dr. Google.
Oh, definitely not. But Dr. Gandino, he also stresses this point about taking a holistic approach.
Looking at the whole body.
The spine and the visceral system.
Because they're all connected.
Right. So besides seeking professional help, are there things we can do on our own to maybe address visceral pain?
Well, Dr. Gandino is a big proponent of movement.
Movement.
Yep. Just getting your body moving can help to shift things around internally.
And potentially release some of that trapped air.
Exactly.
So basically, get up and move.
Pretty good advice in general, I'd say.
True that. Anything else?
Well, he also talks about being mindful of your diet.
What we eat can impact visceral pain.
It can. Certain foods, especially those that are known to cause gas,
Leans, I'm looking at you.
they can definitely contribute to those uncomfortable symptoms.
So maybe skip the extra spicy burrito if you're already feeling bloated.
Probably a wise choice.
Noted.
What else? And lastly, stress management.
Oh yeah, stress can really do a number on your gut.
Tell me about it.
So finding healthy ways to cope with stress. Exercise, meditation, spending time in nature.
All those things can make a big difference, not just for visceral pain, but for overall well-being, too.
It all comes back to that holistic approach, doesn't it?
Absolutely. Taking care of your whole self, mind, and body.
Not just treating the symptoms.
It's about understanding those intricate connections within your body and then making choices that support your health.
This has been such an eye-opening deep dive. But it does leave me with one final question. If visceral manipulation isn't always the answer, and sometimes it's as simple as trapped air, what are some other approaches we can consider?
Good question.
Especially with that connection between the spine and organs that Dr. Gandino talked about. Could addressing spinal issues potentially help alleviate visceral pain too?
Now, that's something to think about.
It really makes you wonder, doesn't it? Like, if the spine is so important for communication between the brain and the organs, could that be the key?
It's definitely a possibility. Remember that analogy Dr. Gandino used with the garden hose?
Oh yeah, the garden hose. What was it again?
So he was saying, imagine your spine is like a garden hose, right? And the water flowing through it is like the nerve impulses traveling back and forth.
Okay, I'm with you.
If there's a kink in that hose, the water's not going to flow properly. Same thing with the spine. If there's a misalignment or a restriction,
It can mess with those nerve signals.
exactly. And that can affect how your organs function.
Wow. So it's not just about treating the organs themselves then?
Right. It's also about making sure that communication pathway between the brain and the organs is clear.
Keep those signals flowing.
Exactly. And that just goes to show, again, how important it is to look at the whole picture when we're talking about pain.
You can't just focus on one little area?
Nope. Because sometimes the root of the problem...
Is miles away from where you're actually feeling the pain.
Exactly. It's like that domino effect you mentioned earlier.
One thing leads to another, and before you know it.
You've got a whole cascade of issues.
And it works the other way around too, right?
Oh, absolutely. If you can identify and address that root cause, that initial domino,
You can start to unravel that whole chain of problems.
and set things back on the right track.
This whole conversation has really got me thinking differently about my body, you know? It's amazing how it all works together, all these different systems.
It really is a remarkable machine.
And we often take it for granted, I think.
Until something goes wrong, right?
Sadly, that's often the case. But hopefully, this deep dive has given everyone a little more insight into the world of visceral pain.
And a greater appreciation for just how complex and interconnected our bodies truly are.
Well said. I think it's safe to say we've covered a lot of ground today.
You've done some serious exploring.
But the most important takeaway, I think,
Is to listen to your body.
yes, pay attention to those signals.
And don't be afraid to seek help if something feels off.
Absolutely. Don't just brush it off or try to tough it out.
Be an advocate for your own health.
And remember, there's so much we still don't know about the human body.
Oh yeah, we're always learning.
But with a curious mind and an open heart,
We can continue to explore and discover new ways to support our well-being.
couldn't have said it better myself. Well, folks, that's a wrap for this deep dive. We hope you enjoyed the journey.
Thanks for joining us.
Until next time, stay curious, keep learning, and keep diving deep.